Question 1. A patient with chronic plaque psoriasis reports thick, scaly plaques on the elbows and knees. Which treatment should the nurse anticipate initiating first for mild disease? A. Systemic corticosteroids. B. Biologic therapy. C. Topical corticosteroids. D. Phototherapy. Answer: C. Topical corticosteroids. Rationale: first-line treatment for mild to moderate plaque psoriasis includes topical corticosteroids to reduce inflammation and scaling. Systemic agents and biologics are reserved for more severe or widespread disease. Phototherapy is also a second-line option. Question 2. A patient receiving biologic therapy for psoriasis reports chills, cough, and fever. What is the nurse's priority action? A. Encourage fluids and rest. B. Notify the healthcare provider immediately. C. Administer prescribed corticosteroids. D. Document the symptoms and reassess later. Answer: B. Notify the healthcare provider immediately. Rationale: biologic agents suppress the immune system, increasing the risk for serious infections. The nurse must report symptoms of infection promptly to avoid complications. Question 3. A patient with erythrodermic psoriasis is admitted with a fever, tachycardia, and extensive skin shedding. What is the nurse's initial priority? A. Apply high-potency topical steroids. B. Start phototherapy. C. Initiate fluid resuscitation. D. Begin methotrexate therapy. Answer: C. Initiate fluid resuscitation. Rationale: erythrodermic psoriasis is a medical emergency due to risk of fluid loss and thermoregulation failure. Fluid resuscitation is the first priority to stabilize the patient. Question 4. Which task is appropriate for the RN to delegate to a UAP when caring for a stable patient with psoriasis? A. Apply prescribed topical medications. B. Evaluate the extent of skin lesions. C. Assist with a therapeutic bath. D. Educate the patient about biologics. Answer: C. Assist with a therapeutic bath. Rationale: a UAP can assist with hygiene-related tasks like baths. Applying medications, evaluating conditions, and patient education require the RN's clinical judgment. Question 5. A patient with psoriasis voices concern about their appearance. Which nursing intervention is most therapeutic? A. Change the subject to avoid discomfort. B. Say, you'll get used to the way it looks. C. Offer support and explore their feelings. D. Encourage avoiding mirrors. Answer: C. Offer support and explore their feelings. Rationale: therapeutic communication involves active listening and allowing the patient to express emotions. Avoiding the issue or minimizing it is non-therapeutic. Question 6. Which finding in a psoriasis patient receiving methotrexate should the nurse report immediately? A. Mild fatigue. B. Sore throat and low-grade fever. C. Occasional nausea. D. Dry, scaling skin. Answer: B. Sore throat and low-grade fever. Rationale: methotrexate suppresses bone marrow and increases infection risk. Signs of infection must be reported immediately to prevent serious complications. Question 7. A nurse is providing discharge teaching for a patient prescribed coal tar shampoo. Which statement indicates correct understanding? A. I will avoid sun exposure after using this. B. I should apply this to open wounds. C. This product is safe to use on my face. D. I'll use it every day, regardless of irritation. Answer: A. I will avoid sun exposure after using this. Rationale: coal tar increases photosensitivity. Sun exposure may worsen irritation or cause burns. It should not be applied to open or sensitive areas like the face. Question 8. A nurse is preparing a patient with psoriasis for UVB phototherapy. What is the nurse's priority teaching point? A. Use sunscreen before each session. B. Wear eye protection during therapy. C. You can continue using methotrexate. D. Limit water intake before therapy. Answer B. Wear eye protection during therapy. Rationale. UVB can cause eye damage. Eye protection is essential. Sunscreen is not applied before therapy, and methotrexate may require modification. Question 9. A patient with inverse psoriasis is likely to have plaques in which location? A. Elbows and knees. B. Groin and armpits. C. Scalp and back. D. Fingernails and toenails. Answer B. Groin and armpits. Rationale. Inverse psoriasis affects skin folds such as the groin, axillae, and underbreasts, presenting as smooth, shiny lesions. Other types affect scalp, nails, or limbs. Question 10. A patient abruptly stops long-term corticosteroid therapy for psoriasis. What is the greatest risk? A. New plaque formation. B. Hypertensive crisis. C. Adrenal insufficiency. D. Drug resistance. Answer C. Adrenal insufficiency. Rationale. Sudden withdrawal of corticosteroids after long-term use can lead to adrenal insufficiency due to suppressed HPA axis function, resulting in life-threatening symptoms. Question 11. A psoriasis patient expresses confusion about their medication plan. What is the nurse's best action? A. Refer to pharmacy for counseling. B. Reassure the patient it's not complicated. C. Re-explain the plan in simple terms. D. Hand them a printed instruction sheet. Answer C. Re-explain the plan in simple terms. Rationale. Nurses must assess patient understanding and use effective teaching strategies. Re-explaining builds trust and supports health literacy. Question 12. Which action best demonstrates ethical care for a patient with visible psoriatic lesions? A. Use gloves and gown for standard care. B. Maintain eye contact and speak respectfully. C. Ask if the condition is contagious before touching. D. Limit physical contact to avoid discomfort. Answer B. Maintain eye contact and speak respectfully. Rationale. Ethical care includes preserving patient dignity and avoiding discrimination or stigma. Universal precautions do not apply unless infection is present. Question 13. A nurse is evaluating a psoriasis patient on cyclosporin. Which lab finding is most concerning? A. WBC, 8,000 per cubic millimeter. B. BUN, 25 milligrams per deciliter. C. Creatinine, 2.1 milligrams per deciliter. D. Hemoglobin, 13.5 grams per deciliter. Answer C. Creatinine, 2.1 milligrams per deciliter. Rationale. Cyclosporin is nephrotoxic. Elevated creatinine indicates renal impairment. Other values are within or near normal limits. Question 14. Which statement by a nursing student requires correction regarding psoriasis? A. Psoriasis is an autoimmune disorder. B. It can be triggered by stress. C. It's a contagious skin condition. D. There is no permanent cure. Answer C. It's a contagious skin condition. Rationale. Psoriasis is not contagious. It is an autoimmune, inflammatory skin disorder. Misconceptions can lead to stigma and must be corrected. Question 15. A patient with psoriasis is prescribed acitretin. Which instruction is most important to reinforce? A. Take this medication on an empty stomach. B. Avoid alcohol during and after therapy. C. Store the medication in the refrigerator. D. Stop the drug if you have dry skin. Answer B. Avoid alcohol during and after therapy. Rationale. Alcohol can prolong the presence of acitretin in the body and increase teratogenic risk. Avoidance is essential for months after stopping the drug. Question 16. A nurse is developing a care plan for a patient with psoriasis. Which goal is most appropriate? A. Prevent complete remission. B. Eliminate all plaques permanently. C. Reduce skin inflammation and promote adherence. D. Limit patient access to treatment options. Answer: C. Reduce skin inflammation and promote adherence. Rationale: psoriasis is chronic with no cure. Goals focus on symptom control and helping the patient manage treatment over time. Question 17. A psoriasis patient on biologics is scheduled for a flu vaccine. What should the nurse do? A. Recommend skipping the vaccine. B. Administer the live intranasal flu vaccine. C. Recommend the inactivated flu vaccine. D. Delay therapy until after flu season. Answer: C. Recommend the inactivated flu vaccine. Rationale: patients on immunosuppressants should avoid live vaccines. The inactivated flu vaccine is safe and recommended. Question 18. A patient presents with psoriasis flare after emotional stress. What is the nurse's best response? A. Psoriasis doesn't react to stress. B. Stress is a known trigger. Let's discuss coping tools. C. Only infections cause flare-ups. D. That's probably unrelated. Answer: B. Stress is a known trigger. Let's discuss coping tools. Rationale: stress is a common trigger for flares. Nurses should educate and support patients with emotional and psychological coping strategies. Question 19. Which action supports evidence-based care in managing psoriasis? A. Recommending herbal remedies. B. Applying ice packs to all lesions. C. Using current guidelines for biologic use. D. Encouraging sunlight exposure without limit. Answer: C. Using current guidelines for biologic use. Rationale: evidence-based practice involves applying the best current clinical guidelines and research to patient care, especially with advanced therapies like biologics. Question 20. A nurse is educating a support group of psoriasis patients. Which strategy enhances learning and engagement? A. Use complex medical terms. B. Lecture without interaction. C. Incorporate real-life scenarios and visuals. D. Discourage patient questions to stay on time. Answer: C. Incorporate real-life scenarios and visuals. Rationale: adult learners benefit from interactive, practical, and visual strategies that relate to their real-world experiences. This increases retention and engagement. Question 21. A nurse is caring for a patient with erythrodermic psoriasis presenting with chills and hypotension. What is the nurse's priority action? A. Apply emollients to skin lesions. B. Notify the healthcare provider immediately. C. Reassure the patient and monitor vitals. D. Provide nutritional counseling. Answer: B. Notify the healthcare provider immediately. Rationale: erythrodermic psoriasis is a rare, life-threatening form associated with systemic symptoms such as fever, chills, and hypotension, indicating a medical emergency. The nurse must promptly alert the provider. The other actions are supportive but not the immediate priority. Question 22. Which patient statement about methotrexate for psoriasis requires immediate follow-up? A. I take the medicine every Sunday. B. I drink wine every night to relax. C. I use sunscreen daily. D. I monitor for mouth ulcers. Answer: B. I drink wine every night to relax. Rationale: alcohol use with methotrexate increases the risk for hepatotoxicity. The nurse should immediately address this. The other statements reflect appropriate use and monitoring. Question 23. A nurse delegates the application of prescribed topical treatments to a UAP. What action requires the nurse's intervention? A. The UAP dons gloves before application. B. The UAP applies the cream to intact skin only. C. The UAP documents the medication in the MARCH-D. The UAP reports redness and irritation to the nurse. Answer: C. The UAP documents the medication in the MARCH rationale. Documentation of medication administration must be performed by a licensed nurse. The other actions are within the UAP's role or show appropriate delegation. Question 24. A patient with severe plaque psoriasis is started on biologic therapy. What lab result would concern the nurse most before the next dose? A. White blood cell count 3000 per cubic millimeter. B. Alanine aminotransferase 28 units per liter. C. Hemoglobin 12.5 grams per deciliter. D. Platelet count 190,000 per cubic millimeter. Answer: A. White blood cell count 3000 per cubic millimeter. Rationale: biologic therapy can suppress the immune system. A low WBC count increases infection risk and warrants holding the dose and notifying the provider. Other values are within normal range. Question 25. A patient reports using herbal supplements along with prescribed psoriasis medications. What is the nurse's best response? A. Herbs are natural and safe. B. Stop using all herbs immediately. C. Tell me which supplements you are using. D. Only FDA-approved herbs are allowed. Answer: C. Tell me which supplements you are using. Rationale: nurses must assess first. Some supplements can interact with psoriasis medications. Gathering information ensures safe care without dismissing the patient's preferences. Question 26. A nurse is teaching a patient with scalp psoriasis. Which statement indicates the need for further teaching? A. I will use medicated shampoo as prescribed. B. I will scrub hard to remove thick scales. C. I will gently massage the scalp during treatment. D. I will avoid hair products with alcohol. Answer: B. I will scrub hard to remove thick scales. Rationale: vigorous scrubbing can worsen lesions and cause bleeding, Koebner phenomenon. Gentle care and softening of plaques are safer. Question 27. A nurse is reviewing the plan of care for a patient with inverse psoriasis. Which nursing diagnosis is most appropriate? A. Impaired gas exchange. B. Risk for fluid volume deficit. C. Risk for impaired skin integrity. D. Risk for aspiration. Answer: C. Risk for impaired skin integrity. Rationale: inverse psoriasis affects skin folds where moisture and friction increase breakdown risk. The other diagnoses are not directly related to this condition. Question 28. During a community health screening, which patient should the nurse prioritize for referral to a dermatologist? A. A patient with dry elbows and knees. B. A patient with scaly, silvery plaques covering greater than 10% of body. C. A patient with occasional dandruff. D. A patient who reports stress-related acne. Answer: B. A patient with scaly, silvery plaques covering greater than 10% of body. Rationale: extensive plaque psoriasis requires dermatologic management. The other findings are common and typically do not warrant urgent referral. Question 29. A patient with psoriasis expresses frustration over the chronic nature of the disease. What is the nurse's best response? A. At least it's not life-threatening. B. You must learn to accept it. C. I understand how difficult this must be for you. D. Try not to focus on the negative. Answer: C. I understand how difficult this must be for you. Rationale: this empathetic, therapeutic communication validates the patient's emotions. The other responses dismiss or minimize the patient's concerns. Question 30. A patient with severe psoriasis is prescribed cyclosporin. What is the nurse's priority assessment? A. Blood glucose levels. B. Renal function tests. C. Pulmonary function. D. Serum calcium. Answer: B. Renal function tests. Rationale: cyclosporin is nephrotoxic. Regular monitoring of kidney function is essential. Other tests are not as relevant to cyclosporin's adverse effects. Question 31. A nurse is evaluating teaching for a patient on phototherapy. Which patient statement requires correction? A. I will wear UV protective goggles during treatment. B. I can stop treatment as soon as my skin clears. C. I will report any burns or blisters to my provider. D. I understand it may take weeks to see results. Answer: B. I can stop treatment as soon as my skin clears. Rationale: phototherapy should be continued as prescribed, even if symptoms improve, to prevent rebound flares. The other statements are appropriate. Question 32. Which action by a nurse caring for a psoriasis patient receiving etanercept requires immediate intervention? A. Reviewing the patient's vaccination history. B. Monitoring injection site for reaction. C. Preparing to administer a live vaccine. D. Teaching subcutaneous injection technique. Answer: C. Preparing to administer a live vaccine. Rationale: live vaccines are contraindicated with TNF inhibitors, like etanercept, due to immunosuppression. The nurse must stop and notify the provider. Question 33. A nurse is caring for a patient with psoriasis who refuses care and becomes angry. What is the most appropriate action? A. Leave the patient alone until they calm down. B. Enforce the treatment plan regardless of response. C. Explore the patient's feelings about their condition. D. Document noncompliance and move on. Answer: C. Explore the patient's feelings about their condition. Rationale: emotional responses to chronic illness are common. Therapeutic communication and assessment of emotional needs improve care outcomes. Question 34. A newly diagnosed psoriasis patient asks about the cause of their disease. Which explanation is most accurate? A. It is caused by poor hygiene. B. It is a bacterial skin infection. C. It is an autoimmune condition with genetic and environmental triggers. D. It is caused by too much sun exposure. Answer: C. It is an autoimmune condition with genetic and environmental triggers. Rationale: psoriasis results from immune dysfunction, with contributing factors like stress, injury, and infection. The other options are incorrect. Question 35. A nurse is prioritizing care for 4 patients. Which patient should be seen first? A. A patient with mild itching due to psoriasis. B. A patient with new-onset joint pain and swelling. C. A patient requesting moisturizer refill. D. A patient with dry, scaling patches on elbows. Answer: B. A patient with new-onset joint pain and swelling. Rationale: joint involvement may indicate psoriatic arthritis, which can cause permanent damage if untreated. It is a higher priority than skin symptoms. Question 36. A psoriasis patient on systemic corticosteroids develops fever and fatigue. What should the nurse do first? A. Administer antipyretics. B. Assess for signs of infection. C. Encourage rest. D. Check recent lab results. Answer: B. Assess for signs of infection. Rationale: immunosuppressive therapy increases infection risk. The nurse should first assess for infection sources before intervening. Question 37. Which outcome indicates effective treatment for a patient with plaque psoriasis? A. Increased redness and scaling. B. Reduction in plaque size and pruritus. C. Appearance of pustules. D. Worsening joint pain. Answer: B. Reduction in plaque size and pruritus. Rationale: decreased lesion severity and itching suggest improvement. The other signs indicate worsening or complications. Question 38. A patient is concerned about their appearance due to psoriasis. Which nursing action is most therapeutic? A. Encourage the patient to avoid mirrors. B. Emphasize that it could be worse. C. Suggest support group participation. D. Avoid discussing the patient's appearance. Answer: C. Suggest support group participation. Rationale. Support groups provide community and reduce isolation. The other responses are non-therapeutic or dismissive. Question 39. A nurse is caring for a child with guttate psoriasis after a strep infection. What is the best nursing intervention? A. Apply antifungal cream. B. Begin systemic antibiotics. C. Provide supportive skincare and monitor for worsening. D. Avoid using any treatments. Answer. C. Provide supportive skincare and monitor for worsening. Rationale. Guttate psoriasis often follows infection. Skincare and observation are appropriate. Antifungals and unnecessary antibiotics are not indicated. Question 40. A nurse is educating a patient about lifestyle modifications for psoriasis. Which statement reflects understanding? A. I'll use tanning beds to improve my skin. B. I'll manage stress and avoid triggers. C. I'll shower frequently with hot water. D. I'll use harsh soaps to scrub plaques off. Answer. B. I'll manage stress and avoid triggers. Rationale. Stress management and trigger avoidance are key to controlling flare-ups. The other behaviors can worsen psoriasis. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!